Data collection and healthcare education. Hirak Christian Kim, Master of Science in Nursing, a Master of Education, Registered Nurse, Clinical Nurse Leader, Clinical Nurse Educator. Data collection and healthcare education. Data points are necessary to develop the financial statement. Financial statement includes costs, revenue, and profits that can be impacted when hospitals do not receive payment for services by insurance companies and Obamacare. In the clinical setting of hospital units, falls, healthcare-acquired infections, otherwise known as high, and pressure ulcers can result in non-payment by insurance and Obamacare, which will mean that the hospital has to pay for all the services provided. It is easy to see why data collection on these clinical matters are important when marketing financial statements and planning. Education is needed on data collection as well as preventing falls, hospital-acquired infections, and pressure ulcers. Education must cover the 3-day rule, patient outcome, patient satisfaction, as impacting financial status of hospitals. Terms defined in this presentation are value-based healthcare, volume-based healthcare, and profit. Data collection and input is done on the electronic health record, or EHR, by nurses and other healthcare team members who document interventions and outcomes. Documenting data is done at every shift in the form of flow sheets and also narrative input in the notes section of the patient's electronic health records. Documents gathered throughout the course of the hospital stay of patients provide data points to demand payment for healthcare services provided and refute denials of healthcare payments by insurance companies and Obamacare. Three clinical factors that can impact financial statement and planning are falls, health care acquired infections, and pressure ulcers, which are considered negative patient outcomes, resulting in insurance companies and Obamacare not paying for healthcare services provided in good faith by the hospital. Although there can be other factors such as chronic illness, conditions of patients, and their genetic disposition when patients fall, acquire new infections in the hospital, or have pressure ulcers 3 days after being admitted to the hospital. Then hospital and its staff are blamed, and hospital will be required to pay for patients' hospital bills. Falls occur in hospitals and impact patients negatively. Some patients suffer injuries from falls, such as broken hip or concussion to the head. Some patients who suffer falls can end up dying from the fall, even if there is no injury to the patient. Patient and patient's family may lose trust in the hospital and the hospital staff as the result of the falls. From financial statement perspective, every fall that is not paid for by insurance means that the cost of treatment will be absorbed by the hospital and erode hospital profits. For small hospitals having to pay treatments for many patients, suffering falls can cause hospital to go bankrupt. Healthcare acquired infections, or HAI, are infections that the patient can get after being admitted to the hospital by another patient, visitor, or hospital staff. Hospital has many patients with many different conditions, so that patients can get infections in the hospital setting without proper isolation precautions practiced. For example, a patient who does not have COVID-19 can get COVID-19 infection from another patient in the hospital or visitors to the hospital. Even if visitors gave patient COVID-19, insurance companies and Obamacare will blame the hospital for the infection that the patient acquired 3 days after being admitted to the hospital, and will require the hospital to pay for services provided to the patient. Pressure ulcers can develop for patients who stay in hospital for many different reasons. The patient may have diabetes or other chronic conditions which compromise the patient's skin integrity. Older patients are more likely to develop pressure ulcers. Not moving around much due to disease process can cause this, as well as after surgery. Can cause pressure ulcers too. Pressure ulcers get progressively worse, and pressure ulcers are difficult to treat. Advanced stages of pressure ulcers require wound consult so that wound specialists can ascertain the best way to treat the patient's advanced pressure ulcers based on the patient's condition. Data collection is done to solve client problems as well as financial problems. Clinically, there is a need to ensure best efforts for positive patient outcomes and reduction of errors. Financially, there is a need to find ways to reduce falls. Hospital-acquired infections, HAI, and pressure ulcers because they can reduce hospital revenue. And it is a double jeopardy because not only the hospital pays for the services, but the hospital also has to pay for the cost of healthcare for patients suffering falls. So they don't get paid and they have to pay. So that's why it's double jeopardy. Thus, these data points are highly relevant to hospital financial statements and planning. Education can be used to solve clinical problems, and data is used to target education. Education is provided on the 3-day rule. If there are conditions in the patient that develops within 3 days, such as hospital-acquired infections like C.Diff infection or COVID-19, then the insurance companies will pay for costs related to the infection because the assumption is that these infections happen before hospital admission. But if the infection develops after 3 days of being admitted to the hospital, insurance companies and Obamacare would not pay for treatment related to it. One can see how the cost to the hospital can be very high per patient who has a hospital-acquired infection high, it can be in the tens of thousands of dollars or more per patient, that the hospital will not be paid for by insurance companies, and the hospital will have to pay for the treatments. In essence, insurance companies and Obamacare blame nurses and other hospital staff for hospital-acquired infections or high. Education can be provided to improve clinical practice and patient outcomes when there is growing number of falls, hospital-acquired infections, and pressure ulcers. What are the factors leading to negative patient outcomes? Education can be provided on prevention of falls, hospital-acquired infections, and pressure ulcers. Education can focus on reducing errors and recommend interventions that can help reduce falls, hospital-acquired infections, and pressure injuries in the future. Education based on data points must also consider the importance of patient satisfaction. If patients recover well without any falls, hospital-acquired infections, and pressure ulcers, then patients will be happier. Happy patients will say positive things about the hospital, so the hospital will get more patients opting into elective procedures at that hospital. More hospital patients to the hospital means higher potential profits for the hospital. Providing education to reduce falls, hospital-acquired infections, and pressure ulcers contributes to a better customer relations. Education to reduce falls, hospital-acquired infections, and pressure ulcers is related to financial planning and financial statements. There are more important terms which highlight why this is the case. Important terms to examine are value-based healthcare, volume-based healthcare, and profit. Value-based healthcare is the new healthcare payment paradigm supported by Obamacare that rewards positive patient outcomes and punishes hospitals for negative patient outcomes. Falls, hospital-acquired infections, and pressure ulcers are negative patient outcomes for which insurance companies do not pay the hospital. The metrics for deciding what constitutes negative patient outcome for which no payment is made is decided by insurance companies, which have been criticized as fundamentally unfair. Furthermore, critics say that this means that all the nursing care for the patient was provided for free, and that value-based healthcare makes it like working like a slave for free. Volume-based healthcare is what existed before value-based healthcare system. Under volume-based healthcare system, payment was made for every healthcare service provided, regardless of patient outcome. Many critics of Obamacare's value-based healthcare system say that volume-based healthcare system is more ethical from labor perspective because nurses and other healthcare workers should not work for free. Profit is revenue minus expenditure in order to make a profit. The hospital has to have more income or payments than cost or expenditures. In order to have more payments, hospital must ensure that the hospital is paid for healthcare services provided. Under value-based payment system, patients who have falls, hospital-acquired infections, and pressure ulcers may not have insurance companies paying for treatments. Thus, data points supported by education can help improve financial situation of the hospital. From the vantage point of hospitals and nurses, value-based healthcare system seems unfair because value-based healthcare system assumes that negative patient outcomes are the fault of nurses and hospitals. Because value-based healthcare does not pay for negative patient outcomes, many small and community-based hospitals cannot absorb the cost of patient treatments, and some had to shut down permanently. This ended up creating greater health inequity, especially in rural areas and poor urban areas. Data collection can help hospitals survive financially in current Obamacare value-based healthcare system. These are the references for this presentation, and there is growing research on Obamacare, critically examining it, a value-based healthcare system, comparing it to volume-based healthcare system, in light of labor ethics and ethical treatment of nurses and hospitals. I hope you enjoyed the presentation.